Touching it to other, what could have happened that that I felt I got this illness.
Yeah.
But by the diagnosis given by the doctors here, it is a medical condition that does not give me a life sentence, like I'm sentenced to death, but instead they've got a way of dealing with it so that I can live normally. So that normal life, I think I regained it. And people are very much surprised as well that although I have the cables and the batteries, I could do almost everything that they were doing, except like I could not play in rain again, but I could play football at the backyard, just kicking the ball across. I kick to the next person, the other person also kicks back to me. Yeah, so it was something good. I could do my own laundry. I could cook also sometimes, maybe do cleaning the utensils, cleaning the house, laying my bed. These are things that I was not able to do before the surgery. But after the operation, which was successful, I pretty much can say I lived a normal life. Take walks as well. On the hills. My place has a number of hills. So around the hills I could walk around. And it was really pleasant. And I really thank the doctors and the hospital team that helped me in seeing that I regained my life. I look forward to living a much more normal life, I suppose. I may enroll for studies, who knows, and with that it will keep me more engaged as well in terms of my mental also activity as well. So my mental activity, getting engaged, and physical activity, I'm out there doing my normal jobs in terms of praying, in terms of conferring the sacraments and blessing houses, visiting people. So life is pretty much normal with the LVAD. So I really appreciate the doctors, the hospital, and the other staff who helped me to live pretty much a normal life. Right now, of course, with some restrictions with the diet, then life goes on. Yeah, I can manage that as well. So, yeah.
So he came to us almost after a year.
Yeah.
And me and our team, Dr. Madhav, who is our chief intensivist and transplant anesthesiologist, and Dr. Vinay, who happens to be my associate, we all, and Venkat Reddy, who is our perfusion in charge, we all checked his device and we did a detailed echo just now, and it is very well functioning. His right ventricular function is also better. He may need a little medication for some more time, which will be slowly. He is on mostly off medications. He was on diuretics, but for almost a few months he was not having any diuretics, and he is having good productive life. And what I would like to give a message is these devices which have become more advanced. In the earlier years they were having a lot of problems. Like I was telling to him that we were having device which was coming out, the lead was coming out from the stomach or from the abdomen. So this device we have, which the lead is at the head, on the head, so it is less chances of infection, and it is like if he gets into water to swim, also he can swim. Just he needs to keep the batteries a little away. So with the one with abdomen device, the one which has the drive line coming from the abdomen, you are high chances of getting infection, and you cannot take bath properly because you can always the fear of water entering into your device and all. So this is a very, very new lease of life for the successful. He came to us in a very bad shape, but we could regain him, and we are very happy to see him back. And he is like active and is moving around. He will be there with us for a few months, and we will be adjusting his few medicines. And I was just talking to him that these devices have become more advanced. Now he is having these cables and all. So in the years to come, we will have left ventricular assist device where we need not have cables. They will be charged directly by contact. So there will be a charging plate which will be put inside the chest, and the batteries will be just, you have to be keeping in touch with your body, just like how the mobiles are getting charged nowadays. So this technology, maybe it will be available in another 5 or 6 years, and surely it will benefit most of our patients.